You know, that persistent sniffling, maybe runny nose in your dog that just never seems to clear up. It can be really frustrating, maybe even a bit worrying.
It definitely can. And today, we're going to dive into one possible reason behind those stubborn issues: nasal aspergillosis.
Right, nasal aspergillosis. We've looked through some pretty detailed sources on
We
this.
have. We're aiming to get a good handle on this fungal disease. It's seen more often in dogs, but cats can get it too.
Okay, so nasal aspergillosis, it sounds kind of complex.
Yeah.
In simple terms, what is it? What's happening?
Fundamentally, it's a fungal infection. It takes root in the nasal cavity and sometimes the frontal sinuses. The main fungus involved is usually Aspergillus fumigatus.
Aspergillus fumigatus. That sounds familiar.
Yeah, it's actually a super common mold. It's
Mhm.
practically everywhere in the environment, soil, decaying leaves, you name it. It's usually harmless, but it's what we call an opportunistic pathogen.
Meaning it needs a chance, an opportunity to cause trouble.
Exactly. It doesn't usually bother a healthy animal, but if the conditions are right, maybe the animal inhales a large amount of spores, or there's some underlying issue, it can invade the nasal tissues and start causing problems.
And so pets aren't catching this from each other. It's really coming from breathing it in.
That's the current understanding, yes. They inhale these microscopic spores, and in certain dogs or cats, this kicks off a reaction inside the nose.
What kind of reaction?
Well, it starts damaging the turbinates. Those are the delicate sort of scroll-like bones inside the nose that warm and filter air. The fungus can form these thick, visible mats or plaques, and the body responds with inflammation and often a lot of mucus production.
Ah, okay. So that explains the discharge under C.
Precisely. And those changes, the damage and the inflammation, are what cause the symptoms we'll talk about.
Now, you mentioned it's in the nose and sinuses. In dogs, does it tend to stay there? Or can it spread?
That's a really important point. In dogs, the most common form, what we call sinonasal aspergillosis, is typically locally aggressive, meaning it does significant damage right there in the nose and sinuses, but it usually doesn't spread systemically through the body.
Okay, so it's a serious local problem, but not usually spreading elsewhere in dogs.
Right. Now, cats can be a bit different. They can get the sinonasal form similar to dogs, but sometimes in cats it can be more invasive. It might extend into the area around the eye socket. That's called sino-orbital disease.
Sino-orbital, affecting
Yeah.
the eye area. Okay, so primary systems are respiratory, nose, sinuses, and potentially the orbit in cats. Got it.
Mhm. And interestingly, the sources we looked at mentioned that we don't really know if there's a specific genetic link, like some dogs being genetically more prone to it than others. That's still an unknown.
Okay. And how common is this? If your dog sneezes a few times, should you immediately worry about aspergillus?
Huh, probably not for just a few sneezes. But while we don't have exact numbers for, incidence or prevalence worldwide, the information suggests it is a fairly common reason for dogs to have that chronic persistent nasal discharge. It's definitely on the list of possibilities vets consider in many places.
So common enough that it's worth knowing about if you have a dog with ongoing nasal issues.
Absolutely, especially chronic ones.
And you said dogs are more commonly affected than cats. Any particular types of dogs or ages?
Yeah, the data points towards certain dog breeds being more susceptible, specifically dogs with long noses, the dolichocephalic breeds,
Mhm.
think collies, greyhounds, that type.
Okay, the long-snouted breeds.
Right. And also medium-nosed dogs, the mesocephalic breeds, they seem to be at higher risk too. For cats, there's maybe a hint that short-nosed brachycephalic breeds might be seen more often with it, but it's less clear-cut than in dogs.
And age.
In dogs, it tends to show up more in young to middle-aged animals, not usually puppies, not usually very old dogs, but that middle range.
But cats are different.
Yeah, for cats, there doesn't seem to be a strong age preference. It can happen at various ages, and for both species, male or female, doesn't seem to make a difference. No sex predilection identified.
Okay, so if you have, say, a middle-aged collie with a runny nose that's been going on for weeks, this should maybe be on your radar. What other things might an owner notice historically?
The history is often quite typical. You'll hear about a nasal discharge that's been present for a while, maybe weeks, often months.
Months? Wow.
Yeah, it can be long-standing. And the discharge itself can look different. Sometimes it's like mucus, sometimes it's thick and pus-like, sometimes it's tinged with blood, or you might even see outright nosebleeds, epitaxis. Sneezing is also common.
Okay. Mucus, pus, blood, nosebleeds, sneezing. Quite a range.
It is, and a really key piece of the history, something that often comes up, is that these dogs have frequently already been treated with antibiotics.
Ah, because it looks like a bacterial infection initially.
Exactly. But the antibiotics either didn't help much, or maybe things got a little better for a short time, but then the discharge came right back. That lack of lasting response to antibiotics is a big clue.
That's a really important takeaway for owners. If the antibiotics aren't fixing a long-term snotty nose, think fungal. Okay, so that's what the owner sees. What about when the vet examines the pet? What findings might point towards aspergillosis?
During the physical exam, the vet will likely see that nasal discharge, either from one nostril or sometimes both. Interestingly, sometimes the airflow might actually seem increased on the affected side, possibly because the internal structures, the turbinates, are being destroyed.
Increased airflow. That seems counterintuitive.
It does, but if the filtering structures are gone, air might just rush through more easily. Another potential sign, seen in maybe 40% or so of affected dogs, is changes to the nose itself, the smooth, hairless part, the nasal planum.
What kind of changes?
It can lose its pigment, become depigmented, or even develop sores or ulcers. The dog might also seem painful if you press gently on their face over the sinuses, and the lymph node under the jaw on that side might be swollen.
Okay. And what about cats, especially those with the sino-orbital form you mentioned?
Right. In cats with that more severe form involving the eye area, the signs can be more dramatic. You might hear noisy breathing, like snorting or snoring, called stertor. One eye might bulge forward, that's exophthalmos. You might see ulcers on the roofs of the mouth, the hard palate, the face might look asymmetrical, and often there's very little or no air moving through the affected nostril.
Those sound like pretty clear and worrying signs in cats.
They are. They definitely indicate something significant is going on.
Okay, let's talk causes a bit more.
Mm-hmm.
We know it's the Aspergillus fungus, but why this dog or this cat? Is there usually an underlying trigger?
That's the million-dollar question, isn't it? And honestly, most of the time we don't find a specific underlying reason. It's not usually like there was a pre-existing condition that weakened the nose.
Hmm?
Occasionally, maybe there's a link to something like a foreign object, like a grass seed that got stuck up there, or some kind of facial trauma. But mostly the idea is that the animal probably just inhaled a really large number of spores at some point.
Just bad luck, inhaling a big dose.
Kind of seems that way for many cases. You know, the fungus is ubiquitous. We mentioned A. fumigatus is common in dogs. In cats, we sometimes see other species too, like A. felis, A. niger, or A. flavus. But what specific factors make one animal susceptible when another isn't? We just don't have all the answers yet. The risk factors aren't really well defined.
So if a vet suspects this, based on the history and exam, it sounds like they need to rule out quite a few other things too, right? Because a chronic snotty nose could be other stuff.
Absolutely. The differential diagnosis list is important here. You've got to consider, could it be a foreign body stuck up there? Or an oronasal fistula that's a hole between the mouth and the nasal cavity, maybe from dental disease? Could it be a chronic inflammatory condition, like lymphoplasmacytic rhinitis? Or, unfortunately, could it be cancer, a nasal tumor? Benign growths and called polyps can also cause similar signs. And other fungal infections, like cryptococcus, especially in cats, need to be considered.
That's quite a list. So how do you start narrowing it down? What about lab tests? Does blood work help?
Standard blood tests like a CBC, chemistry panel, urinalysis, they're often, well, pretty normal. Sometimes you might see subtle signs of inflammation on the complete blood count, like a higher white blood cell count, but nothing specific.
So routine bloods aren't usually the key.
Not usually the key for diagnosis, no. But then there are more specific blood tests, serology tests. These look for antibodies that the pet's immune system might have made against the Aspergillus fungus, tests like AGID or ELISA.
And how reliable are those?
They can be helpful, but interpretation is tricky. The sources give some figures for sensitivity and specificity in dogs and cats, which vary a bit. Basically, a positive result supports the suspicion, but doesn't absolutely confirm an active infection because maybe the animal was just exposed. And a negative result doesn't completely rule it out either.
So supportive, but not definitive on their own.
Exactly. It's just one piece of the puzzle. The sources also mention another test, serum galactomannan, but apparently that one's not considered reliable for diagnosing this particular condition. And trying to track antibody levels over time doesn't really correlate well with how the pet is doing clinically either.
Okay, so blood tests give clues. What about actually finding the fungus itself? Like culturing it?
Yes, that's more direct. If you can get a tissue sample directly from an affected area inside the nose or sinus and send that for fungal culture, it's got high specificity, meaning if it grows aspergillus, it's very likely significant. Sensitivity is pretty good in dogs, too.
But just swabbing the snot isn't enough.
Generally not very reliable, no, because like we said, Aspergillus spores are everywhere. You might just culture spores that were inhaled and aren't actually causing the infection. So tissue culture is much better than a discharge swab.
Makes sense.
Well,
You need to sample the diseased tissue itself. Okay, what about looking inside? Imaging, x-rays, CT scans.
imaging is crucial,
Right.
really, really important. And computed tomography, the CT scan, is definitely the preferred method here.
Why CT over standard x-rays?
CT gives you much more detail. It can show the characteristic destruction of those turbinate bones, thickening of the nasal lining, maybe a mass-like appearance in the frontal sinuses. In cats, it can show soft tissue masses further back. But critically,
Yeah.
absolutely critically,
Yes.
it allows evaluation of the cribriform plate. That's the very thin sieve-like bone separating the nasal cavity from the brain cavity.
Ah, right. You mentioned that earlier. Why is seeing that so important?
Because one of the main treatments involves flushing antifungal medication directly into the nasal passages. If that cribriform plate is damaged or has holes in it, the medication could potentially get into the brain, which can cause severe neurological problems, even death. So you must know the status of that plate before considering topical treatment.
Wow. Okay, so CT is essential for treatment planning, not just diagnosis.
Absolutely essential. Standard skull x-rays can sometimes show suggestive signs like turbinate damage or sinus cloudiness, but they just don't give you that detailed view of the cribriform plate. You can't assess it properly with regular x-rays.
Understood. CT is the way to go for imaging. What about actually looking inside with a camera, rhinoscopy?
Yes, rhinoscopy is another key diagnostic step. This uses a small scope, either flexible or rigid, to go into the nasal passages and the area behind them, the nasopharynx. Sometimes, if disease has opened things up, you might even get a peek into the frontal sinuses.
And what are you looking for?
The classic finding is seeing the fungal plaques themselves. These growths, these mats of fungus, can be white or yellow, sometimes black, maybe even greenish. They're typically stuck to the lining of the nose or sinuses.
So if you see those plaques,
Seeing those fungal plaques is considered pretty much diagnostic. It confirms Aspergillus is there and growing. If you don't see obvious plaques in the main nasal passages, sometimes a closer look into the sinuses, called sinuscopy, might be needed.
okay. And once you see something suspicious, whether it's plaques or just abnormal tissue, how do you get the final confirmation?
Biopsy, that's the gold standard for definitive diagnosis. During the rhinoscopy, the vet uses tiny instruments passed through the scope to take small tissue samples from those abnormal areas, ideally from the plaques themselves if they're visible.
Under direct visualization so you know what you're sampling.
Exactly. Not just randomly grabbing tissue. These biopsies are then sent to a pathologist.
And what does the pathologist look for under the microscope?
They're looking for the fungus itself, the characteristic hyphae, which are these branching thread-like structures with cross walls called septae. They might also see the spores, the conidia, and typically they'll also see lots of inflammation in the tissue around the fungus, often neutrophils or maybe lymphocytes and plasma cells.
So the biopsy confirms the fungus is in the tissue, causing inflammation.
Precisely. And the sources emphasize avoiding blind biopsies, just sticking forceps up the nose without seeing where you're grabbing, because you might just get inflamed tissue without the fungus and miss the diagnosis.
Right. Need that targeted approach. Okay, this gives us a much clearer picture of how complex the diagnosis can be. Let's shift gears now to treatment. Once it's confirmed, what happens next? What's the plan?
Okay, treatment. Once you have the diagnosis, appropriate care often involves the pet staying in the hospital overnight, at least initially, especially after procedures like the topical antifungal infusion or any surgery.
What kind of nursing care is needed?
Mostly supportive, making sure the nostrils are kept clear of discharge. Usually, activity restriction isn't necessary unless there's significant bleeding.
And what about surgery? Is that always part of the plan?
Not always, but surgical debridement is often very helpful. This means the surgeon goes in, usually endoscopically through the nose or sometimes through small openings, and physically removes as much of the visible fungal plaques and debris as possible.
Why is that important?
It helps the antifungal medications penetrate better and work more effectively. You're essentially reducing the fungal load that the drugs have to deal with.
Makes sense. Get rid of the bulk of it first.
Exactly. And in dogs, where the infection is heavily involving the frontal sinuses, a procedure called trephination might be done.
Trephination, what's that?
It involves drilling one or more small holes through the bone directly into the frontal sinus. This allows the surgeon to look inside, clean out fungal material, flush the sinus thoroughly, and even instill medication directly into the sinus.
Sounds quite involved.
It can be, but it's sometimes necessary for those difficult sinus cases. And then for those really severe sino-orbital cases in cats we talked about, sometimes more aggressive surgery is needed to remove the diseased tissue, which might even involve removing the eye and surrounding tissues if they're badly affected.
Wow. Okay, so surgery is often about cleaning things out to help the medications work. Let's talk about those medications. I see topical and systemic options, which is usually tried first.
For dogs, topical antifungal therapy is generally the first-line approach. This usually involves using drugs like clotrimazole or enilconazole.
Clotrimazole,
Yeah.
like the stuff used for athlete's foot.
It's the same class of drug, yes, and is all antifungal, but this is a specific veterinary formulation and procedure. It involves putting the dog under general anesthesia.
Okay, anesthesia is required.
Yes, definitely. Then catheters, often Foley catheters with inflatable cuffs, are placed to block the back of the throat and the nostrils. This creates a sealed space. The antifungal solution is then infused into the nasal cavity and sinuses and left there to soak for about an hour. The dog is often repositioned during this time, maybe rolled side to side, head up, head down to try and get the liquid into all the nooks and crannies.
An hour-long soak under anesthesia.
That's the typical protocol, and it has pretty high reported success rates in dogs, BUT, and this is a big but for owners to understand. It often requires multiple treatments.
Not just a one-time fix usually.
Rarely. It's very common for dogs to need 2, 3, or sometimes even more of these infusion treatments, usually spaced a few weeks apart, to fully clear the infection. That's a key piece of client education.
Okay, multiple topical treatments are the norm for dogs. What about cats?
Topical therapy has been used in cats with the sinonasal form, but the results seem more variable, maybe not quite as consistently successful as in dogs.
So, topical is the go-to first step for dogs, requires anesthesia, usually needs repeating. When would you consider systemic drugs, the pills or injections?
Systemic antifungals, typically the triazoles like itraconazole, voriconazole, or posaconazole, come into play in a few situations. The main one is if that cribriform plate is compromised.
Right, if the CT shows damage there.
Exactly. You absolutely wouldn't want to put topical medication in then because of the risk of it reaching the brain. So systemic drugs are needed in that case. They're also often the primary choice for treating cats, especially those with sino-orbital disease. And sometimes they're used in combination with topical therapy, maybe as a follow-up.
Are there downsides to the systemic drugs?
Well, they require long-term administration, often for months, and they can be quite expensive, which is a consideration. Also, like any drug, they have potential side effects we need to monitor for.
What about specific drugs? Does one work better than others?
Itraconazole is probably the most commonly used and has published dosages and some efficacy data for both dogs and cats. Voriconazole is another option, but the sources note it hasn't been studied as much as a sole treatment, and there have been reports of potential neurological side effects in cats, so caution is needed there. Posaconazole is newer, also potentially effective, but maybe less established as a standalone treatment yet.
And one you mentioned not to use.
Right, fluconazole, generally not recommended because Aspergillus tends to be resistant to it. So stick with the other azoles like itraconazole.
Okay, so systemic therapy, mainly for cribriform plate issues, cats, or maybe combination therapy. Are there situations where treatment is just completely contraindicated?
The big contraindication, as we've stressed, is using topical antifungals if that cribriform plate is breached. That's a definite no-go. And for the sino-orbital disease in cats, systemic therapy is really the only viable medical option. Sometimes, in very severe or refractory systemic cases, another drug called amphotericin B might be considered, but it has significant potential for kidney toxicity.
Amphotericin B sounds like a heavy hitter.
It is, usually reserved for difficult situations.
Any specific precautions vets need to take when handling these drugs, especially the topical ones?
Yes, safety first. Both clotrimazole and enilconazole solutions can be irritating, so anyone handling them should wear gloves and eye protection. Enilconazole, in particular, can sometimes cause tissue swelling in the nose and throat, which could potentially lead to airway issues, so patients need careful monitoring during and after the infusion.
Good to know. The sources also mention an alternative approach, something about irrigation and depot therapy.
Ah, yes. That's another technique that's been described. It involves making a small surgical opening into the frontal sinus, similar to trephination. Then they flush the sinus with a dilute clotrimazole solution to clean it out. After flushing, they instill a thicker clotrimazole cream into the sinus.
A cream, like a long-acting deposit.
Exactly, a depot. The idea is that the cream stays in the sinus and slowly releases the antifungal medication over time. The amount used depends on the dog's size. And studies suggest the success rate might be similar to the standard infusion method.
Interesting. Okay, so let's say treatment has been done, maybe one or more topical infusions, maybe systemic drugs. How do you know if it worked? What's the follow-up?
This is really important. In dogs, just seeing the nasal discharge decrease or stop is not enough to be sure the infection is gone.
Really? So even if they look better, they might not be cured.
Correct. The recommendation is actually to perform a follow-up rhinoscopy on all treated dogs, regardless of how they seem clinically.
Another scope procedure.
Yes, to visually inspect the nasal passages and sinuses again, and crucially, to take follow-up biopsies for both microscopic examination, histopathology, and fungal culture. That's the best way to confirm the infection is truly resolved.
So seeing clear tissue and getting negative biopsies and cultures.
That's the goal. Remember we said earlier that tracking antibody levels in the blood isn't reliable for monitoring? This direct look and sampling is much better.
Okay. And what if the signs come back or get worse after treatment?
Then a repeat CT scan might be a good idea, especially to recheck that cribriform plate status before considering another round of topical treatment.
And what about monitoring for side effects from the drugs?
If the pet was on systemic triazoles, like itraconazole, regular blood tests to monitor liver enzymes are important. If amphotericin B was used, then close monitoring of kidney function is critical.
How does follow-up differ for cats?
For cats, follow-up often relies more on monitoring the clinical signs, making sure they resolve and stay resolved. But the same blood work monitoring applies if they were on systemic antifungals, liver enzymes for triazoles, kidney values for amphotericin B.
Is there anything owners can do to prevent this in the first place? Avoid dusty barns or compost heaps?
That's a tough one because the fungus is so widespread in the environment, and we don't fully understand the specific risk factors. There aren't really any proven preventative measures we can recommend right now. It seems to be more about individual susceptibility.
Just bad luck for some, perhaps. What about complications, either from the disease or the treatment?
Sure. Complications can happen. With the topical therapy, besides the potential for medication getting through the cribriform plate if it's damaged, there can sometimes be swelling in the throat area afterwards. If trephination was done, the surgical site could get infected or swollen.
And the systemic drugs.
The triazoles can sometimes cause loss of appetite or, more seriously, liver toxicity. And amphotericin B, as mentioned, carries a significant risk of kidney damage.
So definitely things to watch out for. What's the overall outlook then? The prognosis?
For dogs treated with topical therapy, the initial response is often quite good. Many dogs show significant improvement after 1 to 3 treatments. However, yes, it's becoming clearer that recurrence or reinfection is probably more common than we used to think. A dog might seem cured, but then have the problem flare up again months or even years later. So long-term monitoring is important.
So cure is possible, but recurrence is a definite risk.
It seems so. For cats, the prognosis is generally considered better for the sinonasal form compared to the more invasive sinoorbital form, which can be much more challenging to treat successfully.
Okay, let's try and wrap this up. We've covered a lot of ground on nasal aspergillosis.
We certainly have.
So key takeaways seem to be, it's a fungal infection, mainly aspergillus, causing chronic nasal issues, especially in dogs, particularly long-nosed breeds.
Right. Diagnosis isn't always simple. It often needs that combination of history, exam, advanced imaging like CT to check the cribriform plate, and then rhinoscopy with biopsies and culture.
And treatment for dogs usually involves multiple rounds of topical antifungal infusions under anesthesia, often after surgical debridement. Systemic drugs are an option too, especially if the cribriform plate is involved, or more commonly in cats.
Exactly, and follow-up is crucial, ideally with repeat rhinoscopy and biopsies in dogs, not just relying on whether the symptoms disappear because recurrence can happen.
It really highlights why persistent nasal discharge shouldn't just be ignored or treated endlessly with antibiotics without a deeper look.
Absolutely. Getting that accurate diagnosis and appropriate treatment plan is key for managing this condition effectively.
This has been incredibly informative, definitely sheds light on a condition that can be quite challenging for pets and owners.
Glad we could dive into it.
So for our final thought today, here's something to chew on. We know aspergillus is everywhere, right? It's in the air, the soil, and we know recurrence is a real issue even after treatment seems successful. So what other, maybe more subtle factors could be at play? Could there be specific things about an individual animal's immune response? Or maybe tiny differences in their nasal environment? Or even specific, repeated microexposures that tip the balance and allow this common fungus to cause disease in one animal, but not another.
That's a fascinating question. Definitely points towards areas where more research could help us understand why some pets are susceptible.
Something for you, the listener, to ponder. Why does this common mold sometimes become such a problem?